Hello, I'm Urologist Erdem Akkaya. What is dehydroepiandrosterone? Today we will have a short video presentation about it. Dehydroepiandrosterone is the most abundant sex hormone in the body. Dehydroepiandrosterone is one of the steps of the sex hormone. How are sex hormones made in the body? The body takes cholesterol, converts it to pregnenolone. From pregnenolone it is converted to dehydroepiandrosterone. This then converts to androsterone, androstenol, and then testosterone and estrogen. This is how sex hormones are produced. Sex hormones are produced in the body by the adrenal glands, testes in men and ovaries in women. Dehydroepiandrosterone is one of the precursors of testosterone and estrogen. So what kind of effects does dehydroepiandrosterone have when used in the body? If we look at the brief history of dehydroepiandrosterone became famous in the world when its sales exploded after a famous athlete in America said he used and it was good. If we look at the studies, especially in elderly, postmenopausal women, it is good for attention, memory loss, forgetfulness, skin regeneration. It has been shown in clinical studies that there is an increase in bone density, an increase in movement and mobilization ability, effective and positive results in vaginal atrophy and vaginal dryness. An increase in bone density, an increase in testosterone levels, and an increase in IGF-1 levels have also been observed in men, but studies conducted specifically in older men have shown positive results. That being said, in studies done with young men and among athletes, frankly, studies with low doses, that is, doses of 50 to 100 milligrams, did not show an increase in testosterone levels, and in other studies there was an increase of between 16% and 34%. Of course, for anabolic users, an increase of between 16% and 34% is not significant at all. Also, the range of patients here is obviously not evaluated. Now is testosterone between 300 to 400 below 400, 400 to 600 above 400, or 700. In fact, the studies are not very detailed. In conclusion, dehydroepiandrosterone is actually not much different from normal steroids, which are exogenous steroids taken from outside the body. There are studies that show the suppression of FSH, LH, which we call gonadotropin, when taken in high doses. And the problem with dehydroepiandrosterone is that when you take it into your body, it can convert into estrogen or testosterone. So it's hard to know exactly which one it's going to convert into. This can only be understood from the tests made after 1 month of use. Dehydroepiandrosterone in particular is very effective in women. A small increase in testosterone in women, a small increase in estrogen can increase a woman's sex drive and libido and eliminate many complaints. But in men, there is no significant increase in testosterone or estrogen. Since there is no significant increase, there may not be good results in men, but if the patient's testosterone is very low, a significant increase in testosterone may be obtained if it is used. It is an expensive product and is currently approved in Turkey. There is only one legal form. It has many forms abroad. It is not used as a medicine abroad. It is not used as a medicine in Turkey either. It is manufactured in Turkey under a borderline product license by the Ministry of Health. This is the case with dehydroepiandrosterone. Thank you for listening. Best regards.